Hello, my name is Kimberly Allen, and I'm here to talk to you today about the role of peer recovery and family support in optimizing integrated health outcomes. So we'll be talking more about integrated health if that's not something that you're familiar with. And this is segment one. There are 8 segments where we get more and more into health outcomes. So this project is part of the Texans for Recovery and Resiliency, better known as TRR. TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation of Family for Children's Mental Health, and the Addiction Recovery Community Statewide Network, which is RecoveryPeople. The purpose of this collaboration is to strengthen peer and family voices in mental health and substance use recovery, policy, and program development. So the purpose of this study is to capture the degree to which Texas health systems use or plan to use peer and family support workers and volunteers. We want to discover how recovery and resiliency services are being integrated into hospitals, managed healthcare environments, and employee assistance programs, or may be integrated into healthcare systems in Texas. We want to explore the cost-effective benefits of using peer and family support services, once again in primary care, behavioral health, and employee assistance program settings. And finally, we want to capture the skills and training needed that patient advisory board members and peer and family support staff and peer and family support volunteers need to be an effective part of the healthcare team. So when I gathered the data for this study, it was through semi-structured telephone interviews with key influencers with primary care clinics, hospitals, managed healthcare organizations, and employee assistance program executives. This is qualitative input, meaning that there were no scientists involved, and the results include responses from 13 organizations. I will be using a glossary today. This is for you. PS means peer support. FP means family partner. PC means primary care. And behavioral health includes mental health and substance use. So we'll talk more about behavioral health. I know that that's a term that not everybody uses, but oftentimes in integrated systems, you hear that. They'll use the word behavioral health to talk about both. Managed healthcare is a system of healthcare that's designed to control costs through managed programs. So you've probably heard about health maintenance organizations, which are HMO, and preferred provider organizations known as PPOs. You may be on one of those yourself through your insurance. So commercial insurance or benefits that are private insurance, and that's any kind of insurance not paid for by the government. But I will be reminding you of these terms as we go through. So today we're going to talk about integrated care. What is integrated care? We hear this more and more, and so we'll talk a little bit about the definitions of integrated care. So integrated care is care that results from a practice team of primary care and behavioral health clinicians who work with families and patients. They use a systematic and cost-effective approach to provide patient-centered care for a defined population. And patient-centered care generally means that the patient is involved in their care and does have a voice in their care. And the defined population that we are looking at is behavioral health, people with mental health and substance use disorders and conditions. So the idea is that physical and behavioral health problems often occur at the same time. So integrating services to treat both will yield the best results and be the most acceptable and effective approach for those being served. So we're going to treat them at the same time, mental health problems and physical problems. So here is who I surveyed for the study. I talked to primary care physicians, often working in medical clinics. To give you an idea, I spoke with a regional private medical group practice that specializes in child and adult psychiatry. I spoke to a leader there. I spoke to a group of 9 board-certified family physicians. I spoke with a physician within a team of more than 30 independent family physicians, so that was quite a large group. I spoke to a representative at a medical home family practice. So that group includes over 10 hospitals and over 30 clinics. They do have a behavioral health and chemical dependency unit, so they treat both. I also spoke to a group of 9 physicians specializing in diabetes, and the reason for that is I wanted to speak to a specialized group, and oftentimes persons with mental health and substance use disorders do indeed have diabetes. So in terms of hospital executives, I spoke with a hospital executive that provided very complete information because this system does indeed use peers. So that system is a psychiatric unit with a 50-plus bed capacity. It's part of a medical surgical hospital. The hospital has 500-plus beds, so it's a large hospital. This psych unit has 2 acute adult inpatient units. They have short-term units to provide patients with comprehensive psychiatric evaluation, treatment, and psychiatric management. I also spoke to nurses and nurse supervisors. Typically, these were directors of nursing. One of those worked in a large hospital system with 500-plus beds within that hospital. I also spoke to a nurse with over 20 years experience. He works in a short-term crisis-oriented inpatient psych hospital with 100-plus beds and a psychiatric emergency room. There are over 30 physicians on staff, as well as the system having an integrated outpatient care. So in outpatient, the patients do receive care by physicians who specialize in mental health and internal medicine at one location. So that team has psychiatrists that offer med management services, as well as internal medical doctors that offer a wide range of primary care services. And those services also include licensed therapists. So this is a true integrated healthcare system. I spoke with managed healthcare executives. As you can see, managed healthcare is involved in cost containment. They also work in quality of healthcare. Those 2 managed care environments organizations that I spoke with, each serve over 50 million members throughout the United States. So these are large, MCO is what they're known, large managed care organizations. I also surveyed executives from employee assistance programs. If you're not as familiar with EAPs, we'll talk more about that in another segment. But I did speak with an international employee assistance program, so it was quite large. I also spoke with an executive from a freestanding EAP. That means that it's not connected to insurance. So the international EAP is part of managed healthcare, and the freestanding EAP is not connected to insurance, that being managed health. I spoke to a community healthcare executive. This provider group is connected to a hospital, and this is their own language. They support the integration of physical and behavioral healthcare systems. They believe that it's central to enhancing quality and lowering cost of healthcare in Texas. So that is what we're talking about today, the integration of physical and behavioral healthcare, and we're talking about quality and the lowering cost of healthcare in Texas. So speaking to these environments and these individuals, we know that there are challenges in healthcare. And I'm always mindful of that, the challenges that these providers face. They deal with patients or people with common medical disorders. We know that people with common medical disorders have high rates of behavioral health concerns. And people with mental health and substance use disorders may die decades earlier than the average person. So that's a staggering situation, decades earlier. These persons die from untreated and preventable chronic illnesses, for example, diabetes, heart disease, and obesity. So if you can imagine dying from an untreated chronic illness that is preventable or certainly can be helped. So the challenges that patients face in healthcare is that behavioral health consumers in primary care settings are less likely to receive effective medical care, and that includes preventive services. So if you have a behavioral health concern and you go into a primary care settings, which often primary care is your first entry into healthcare, then you are less likely to receive effective medical care. So patients report difficulties establishing relationships with primary care providers, and they face stigma within primary care settings. So the challenges in healthcare also include challenges in navigating complex healthcare systems. This is a major obstacle to care. If you've ever been through a healthcare system, you've probably had this issue that navigating these large, complex healthcare systems have an impact. It's hard to figure it out. These systems are fragmented systems. Oftentimes there are communication challenges because they're fragmented. They're not under the same roof necessarily. They're professional bureaucracies, meaning that perhaps there is a medical healthcare professional that doesn't communicate as well with a technician that's doing hands-on care, just as an example. And there are departmental silos, which means that departments like psychiatric departments may be working side by side with medical departments, but they're siloed, meaning that they don't connect. It's like a silo that you would keep grain in. They don't connect. They're solo. So those are the problems. So what's the solution? The solution lies in integrated care, where we integrate mental health and substance abuse treatment, as well as primary care, because this produces the best outcomes and proves the most effective approach in treating patients today. Now, when we talk about these integrated healthcare environments, I specifically wanted to look at certified peers who work within these environments. This is kind of a new thing, so we want to look at what this actually looks like. So who are peers and what do they do? When we're talking about peers, we're talking about people who are trained and certified to provide non-clinical, non-professional assistance to other peers and family members in order to foster resiliency, initiate and maintain recovery, and or enhance the quality of life. So it's important to notice that this is non-clinical, non-professional assistance. So we're not talking about nurses or someone who's licensed. We're talking about someone who's trained and someone who's certified to share their own lived experiences and to foster resiliency in people and help them to initiate and maintain their own recovery. So why are we looking at just certified peers and family partners? Why aren't we looking at other peers? Well, when you look at these quotes, these are taken from real environments. The top quote is from that 500-bed hospital that has the psych unit within it with 50 plus beds, and they say, we do use certified peers. We also give them a general hospital orientation. So this is something that they often do. The next quotes are taken from the Managed Healthcare Organization serving over 50 million people. They say all their peers are certified. Those peers are certified in compliance with each state that they work within. The last quote is from an inpatient psychiatric hospital. They say their peers are certified. They also have to go through hospital orientation, the same as other employees, and this includes a background check. So when we look at the credentials in Texas for peers, there are 3 for peer supporters and family partners. We have Certified Peer Recovery Specialist, PRS, Certified Peer Specialist, known as CPS, and Certified Family Partners, CFP. So sometimes you'll see a different acronym for some of these, but this is what we're talking about in Texas today. The Certified Peer Recovery Specialists are commonly known or sometimes known as recovery coaches. These are people that are age 18 or older. They have lived experience recovering from substance use or co-occurring disorders. They at least have a high school graduate degree or a GED, and they have met and maintained the Texas Certification Board of Addiction Professionals requirements. And those requirements include a 46-hour training, 25 hours of supervision, 500 hours of experience, and a test. And every 2 years, we take 20 hours of continuing education units every 2 years. So the training is ongoing. When we talk about certified peer specialists, we talk about people 18 years or older with a diagnosis of a mental illness and current or prior use of mental health services with at least a high school graduate degree or a GED, and who have met and maintained via HOPES requirements. And this includes a 43-hour training and a test, as well as 20 hours of continuing education units every 2 years. So once again, this is ongoing education that we have. Certified family partners are a parent or a guardian who has the lived experience of raising a child with mental or emotional challenges, and they have learned to successfully navigate the systems of care, and they have met and maintained via HOPES requirements. And those requirements include a 3-day training and a test and 20 hours of CEUs every 2 years. So if you'd like to learn more about this, certainly you can view the other videos in this series of 8 on the role of peers and family supporters in integrated health systems. I would welcome if you drop me a note. There's my contact information, Kimberly Allen at RecoveryPeople.org, and you can certainly visit RecoveryPeople.org or RecoveryandResiliency.org. And thanks for listening today. I hope you enjoyed it.